I chose to incorporate DRX 9000 into my office because chiropractic itself, hands-on chiropractic, is a very powerful tool. However, there are limitations for people with sciatica, pinched nerves, and significant disc problems, degenerative discs, that we needed higher tech tools, extremely high tech technology, to help us do what we cannot do with hands-on alone. The best candidates for DRX 9000 are those with an acute sciatica due to a disc problem. That means actually a disc pressing on the nerve, very much like this, where the red material pushes on the nerve due to a damaged disc. It can be progressive or it can happen suddenly, and usually the patient has significant leg pain and or back pain, maybe numbness and tingling, maybe weakness. Sometimes it's just nagging and doesn't want to go away. Nagging back pain and leg pain are common things that we help with. And what DRX 9000 does is to help actually get the normal healing to actually occur within the disc by decompressing the disc. Simple traction and decompression are very different. Now, decompression gets into negative pressures where the disc can actually imbibe the normal nutrients back into it to help rehabilitate the disc. Also, DRX 9000 is very sophisticated technology that allows for negative pressures decompression, true decompression. DRX 9000 is true non-surgical spinal decompression, whereas many units out there are just advanced traction units or just simply traction units. A typical DRX treatment for the lower back, a patient is first of all needs to be a good candidate, and we do that on the initial consultation and look at all their results, order more tests if necessary. If they are a good candidate, then we have that discussion with them, and then when they choose to start treatment, we want to make sure they have a very high percentage of getting good, lasting results with DRX 9000. In our office, that qualifies a good candidate. People who would not be candidates for decompression would be those who have had severe spinal trauma that is unstable, or they have had recent back surgery. We do see some people who have had back surgery after 6 months may be candidates, or neck surgery after 12 months. So we have helped a number of people who have had surgery and has not been successful with surgery. So this does offer hope. Those tend to be more complicated cases, but again, we rule that in or rule that out on the initial visit consultation. Some elderly patients we can help, particularly I would like to say regardless of age, degenerative lower back problems and neck problems, we can often help them. Typical treatment involves they are harnessed into a special harness, and gently they are laid down on the table and secured onto the table, and then the DRX 9000 using very sophisticated pulls and angles are set to customize to each individual client so that we can get the best results for them based on all their results. And typical treatment is half an hour. They're followed up with a couple other treatments, therapeutic laser, most of the time adjustments as well, and then followed up closely well after their protocol of treatments. The cervical or the neck unit is typically for people who have arm pain, numbness, or tingling as a result of a disc problem. Often it's a bulging disc or stenosis in the neck due to chronic degeneration or otherwise known as arthritis. And those are the best candidates. Sometimes they actually have a herniated disc. Those are based on MRI results. And typically they are getting arm pain, may present as shoulder pain and or neck pain. There may or may not be numbness or tingling. We've had many patients who have been many different places, including many chiropractors, with no good results or not lasting results. And we determined that DRX is likely to help them. We've had some patients that have had phenomenal results. One particular case I can think of has had chronic degenerative lower back pain for 20 plus years, been going to a chiropractor virtually that whole time, and after his first few treatments has been totally pain-free. In recent follow-up, he is still totally pain-free. He is totally amazed. It's like a miracle.